I'm going to try and keep this short, sweet and to the point because I just really want to hit you with the obviousness here. And it should be obvious why people from places like the UK that have socialised healthcare systems tend to look at Americans like a dog that's been shown a card trick whenever they speak about the evils or perils of socialised medicine. In the United States, combined between what you do pay out on Medicare and similar things and what you pay out in terms of private health insurance, you pay out around $9,500 per capita. That's for what little public medicine you do have and for the private medicine that you do have per head per year. In the United Kingdom, we pay out about $4,000 per person per year, combination public and private costs combined. Now, people will say this is an unfair comparison, the USA is much bigger. The thing is that scale helps in these instances. If you're a bigger economy with more people, then the economy of scale kicks in even more, so you would get an even better deal than the UK does. But still, you know, there are some worthwhile problems there that do need discussing. You know, the US is much bigger. It does have a lower population density, so let's go have a look at Australia. Australia has a population density about 1/10 of that in the US. Lower population, smaller economy. Australians pay out about $5,000 per year per capita, combined public and private expenses for medicine. So that's not really an issue, is it? Okay, well, what about the quality of this care? Well, America is ranked 30th. It rose about 6 places after the Affordable Care Act came in, making health insurance more accessible, but it still ranks around 30th in the world. And every single healthcare system that ranks higher than the US is a socialised system. The UK is ranked 13th, and Australia, for all its geographical problems, is ranked 9th. So the UK, to take the less good example, has a healthcare system approximately twice as good as the American system for less than half the price. This also has a positive knock-on effect on the accessibility and affordability of private health insurance. For example, in the UK, a typical private insurance plan costs around $2,000 per year, with roughly $650 excess equivalent. So we could, all of us, top up our health cover with private insurance worth $2,000 and we'd still be paying less than the US is currently paying and getting a better health service for it. Now, it's not to say there aren't problems with socialised healthcare, waiting lists and so on, but these are also its strengths because we're treating people not necessarily based upon the weight of their pocketbook, but upon the urgency of their need for care. And that's a much fairer and healthier way to go about things, I would think. This is of particular concern today as we face down the coronavirus, because people in the States are being told that they're still going to have to pay to go into hospital if they become gravely ill with the coronavirus, which means more people are less likely to go to the doctors for assistance, to get tested, and then to self-segregate from the population, which will only aid its spread, because basically they can't afford not to infect everybody else. Not good for public health. This is the same point we've been trying to make to anti-vax activists since forever. A healthy general population is good for a healthy me as an individual. But I'm not quite done. Please keep in mind that in giving you these figures, I've rounded them in the USA's favour. I've rounded down the costs when it comes to America, and I've rounded up the costs when it comes to everywhere else, by as much as $250. Zang.